they, again, put up a website asking to be spy on folks who are gathering signatures and call people racists and bigots if they sign the petition, and yet their own members sign the petition. Part of this, again, referendum is about having that broader conversation about where our healthcare dollars are really going. And when you have people who are writing a $2,000 a month payment for their own healthcare, and then you've got double coverage of two public employee spouses at full, $34,000 being funded by taxpayers, there's an equity problem there. And then you're going to ask those people to pay a tax, the people who are writing the $2,000 check. I think that the boots on the ground public employees are incredibly, the ones I've talked to, the ones who volunteer for this petition, incredibly rational, smart, caring people who want to see us do the right things. I think there are unions who they are, some of them are forcibly having to pay dues to, have a very different idea about how to do that. And the real question is do we have the political will? It's sad when you're starting to be nostalgic for John Kitzhaber because he actually had the political will to do that. I mean, I think one of, the bigger problems is we have legislation that got enacted, and particularly in the CCO legislation. If you read Section 13 of the 2011 bill, it said that once we stood up CCOs for Medicaid, that we would start to have the conversation about doing it for PEB and OEP. And then he left for lots of reasons, and that conversation never happened. So that's already in the law, and we're not doing it. I don't necessarily, I think it's better that they go into the exchange because then you bring down the risk pool for all the private ratepayers. But whether we put public employees in the exchange or, Governor Kitzhaber believes putting them in CCOs saves $1 billion. Any way you slice it, there's $1 billion, I think. And so we can use those dollars for other things. Yeah, it's a politically hard conversation, but I think, I don't.
Let me give you
but given that the alternatives you've already
let me give you two
proposed don't
specific
get a hearing,
let me give you two specific examples to expand on the answer to that question. You asked, what's your plan? So there's two things that the public employees could easily do. If you have a family working, where there's two adults that are working for a state agency, say just for example, one's working for ODOT and one's working here in the legislature or something, the state of Oregon provides two family health care packages for that, right? They don't look at the two agencies and say, we'll give you one health care package. They provide full coverage for that whole family twice. And most of the employees in Oregon take that twice, right? And it really doesn't help the families. If you've ever had double health care insurance, physical health, dental it helps, but physical health care insurance, and you go down, you go to the doctor, you go to the hospital, whatever, and you say, here's my primary, here's my secondary, and my husband works for another state agency. That double coverage ends up causing pointed fingers. And what happens is employees get caught in the middle. And so we need to look at, as a state, say, we're going to provide these union employees with one family package healthcare. All we have to do is get those two agencies to talk to each other, and they get one healthcare package, not two for the same family. So you're doubling on those. There's hundreds of millions of dollars right there. And then you take K through 12. For example, classified employees in K through 12, your food service, your bus drivers, people like that. They are under the federal poverty level that they would qualify to be in the exchange, right? Where they could go the state could get federal subsidy for all those employees by putting them in exchange. And some of them, they could get 90% of the feds to pay for that. It is beyond me why Oregon is so stubborn to say, no, we're going to turn down those free federal dollars, even though it would be the same insurance company, the same doctors, the same hospitals that these people would access care at if they were put in the exchange. But we pay, Oregon taxpayers pay 100% of that burden for these folks that would be qualified to be in that exchange. I'm not talking about CCO. I'm talking about putting them in the exchange where the federal government picks up to 90% of the tab. Other states do it. Why are we so stubborn that we say we've got to pay for these even though it would make no effect on the employee? They'd still get the insurance. They would just have many federal dollars matched with it.
Well,
we need to do that.
The other thing is if Congress, gets its head squared away and reauthorizes CHIP, I mean, you've got public employees who could put their kids in CHIP, 300% of poverty. A lot of those families would qualify if you're the lunch lady or the bus driver and people, who who are making, are arguably 14, 15 bucks an hour working for a school district, slide your kids over that way. So there's ways we can get really creative. But again, right now, I had a meeting around a table with a bunch of healthcare interests and said, hey, I want to put folks into CCOs and trigger section 13 of the CCO legislation. Those folks don't want to do that. It impacts their profit model, right? Because when you have a double covered spouse and they're getting insurance from an insurance company, the insurance company gets paid twice. So, the reform roadblocks are all over the place. It is in insurance, it is in hospitals, it is in unions. And again, what part of this referendum is about bringing those to the forefront so we can have a bigger public dialogue on what is arguably the biggest chunk of our budget. We pay more particularly for public employee healthcare costs than PERS payments. It is now, healthcare is eclipsed PERS payments. So, and it's something we can actually do something about. It doesn't have the same constitutional problems of, a contract is a contract PERS. We can actually do stuff with the healthcare and find those savings and then use them to actually do what we're supposed to do, which is help our customers, help the taxpayers of Oregon, who should be treated like customers and not like ATM machines.
Okay,